and welcome back to the channel. I hope that everybody is doing well today. If you are new here, then hi, my name is Brittany and I'm a nurse practitioner. I'm also the creator of the Brittany Holzbeck NP Review. It is the most comprehensive and affordable nurse practitioner boards review on the market. The entire course is available on my Patreon. I'll make sure to have everything linked in the description box below. Make sure you read each tier before purchasing because there are 4 tiers available. And also important to know is that it is accredited through the AANP, so if you take the course, you are eligible for continuing education credits. So in today's video, it actually includes an excerpt from my podcast. So if you are unaware, I started a true crime podcast about a month ago, and in my latest video, I discussed the case of Aubrey Wyatt, a 13-year-old girl who took her own life after years of bullying. And so I thought it would be an important topic of discussion for this channel as well, because as healthcare professionals, we are a checkpoint for our youth. And so all healthcare professionals, but especially those working in primary care, should be asking their pediatric patients if they are experiencing bullying and also inquiring about their mental health and whether they are experiencing any self-unaliving ideation behaviors, or if they're practicing self-harm. As healthcare professionals, our role is vital in ensuring that our pediatric patients are safe and they are receiving mental health care. And so in today's video, I am going to discuss self-unaliving in our adolescents and what we can do to help prevent this. If you are interested in listening to the complete episode for my podcast, I will link that channel in the description of this video. And just as a quick caveat, you might have noticed that instead of using the word, I will be using the word unaliving due to YouTube's terms and policies. So although self-unaliving in children and adolescents is relatively rare, it remains one of the leading causes of death in this vulnerable population. And though the act itself is generally infrequent, attempts and ideation are actually quite common in this population. So the World Health Organization reported that in 2014, self-unaliving was the 3rd leading cause of global mortality among children and adolescents between the age of 10 and 19, with nearly 100,000 deaths, and it was the leading cause of death in girls ages 15 to 19 years old. So in the US specifically, there are about 2,600 self-unalivings per year, which accounts for more than 12% of all pediatric deaths, making self-unaliving the 2nd leading cause of mortality in the United States of America, which is huge. And so because of this, universal screening for depression and self-unaliving should be done every year from ages 12 all the way through 21 years old. However, research does say that it can begin as early as 10 years of age or even younger, essentially, if they're at an increased risk for depression. So risk factors for this would include a personal or family history of depression, bipolar, substance use, or other psychiatric illnesses, significant psychosocial stressors, frequent somatic complaints, and then those that are also in foster care or if they've been adopted. All of those would be risk factors for depression. So risk factors that increase the risk for self-unaliving behavior in children and adolescents include psychiatric disorders, with depressive disorder being the most common, history of self-harm, history of previous attempts, history of physical or sexual abuse, exposure to violence or peer victimization, so this is bullying, a family history of depressive disorders, a family history of attempts, access to firearms, alcohol or drug use, and then finally sexual orientation. Multiple studies actually indicate that self-unaliving behavior is 2 to 5 times greater in sexual minority youth. So this would be the youth that identify as lesbian, gay, bisexual, or transgender in comparison to heterosexual youth. So we have the PHQ-2, which has been validated in the use of adolescents, and it consists of only 2 questions. So it starts with, over the past 2 weeks, how often have you been bothered by any of the following problems? 1, little interest or pleasure in doing things, and 2, feeling down, depressed, or hopeless. So the responses for these questions include 0 points for not at all, 1 point for several days, 2 points for more than half the days, and then 3 points for nearly every day. And then adolescents that score a 3 or greater need to undergo, additional assessment for a depressive disorder. In addition to the use of the PHQ-2 and PHQ-9, the best way to identify adolescents that are at risk for self-unaliving is to ask about risk factors, ask about thoughts, and ask about intent. The concern that, talking about self-unaliving could provoke ideation or actions has not been supported by any evidence. Though some do worry about this, it's important to know again that research does not support these claims. We need to be talking about this with our adolescents. So healthcare professionals should interview adolescents with their parents and alone, and this is because a one-on-one conversation with the adolescent can allow for a more open discussion about, if they're experiencing any ideation or behaviors. However, confidentiality should not be promised because in regards to self-unaliving, it just cannot be maintained. So questions regarding self-unaliving should be short, they should be to the point, they should be asked in a very non-judgmental way. So some examples that were provided include, do you ever think about dying and how often? Have you ever wished that you were dead? Do you ever think that the world would be better off without you? Do you think your family or friends would be better off without you? Have you had thoughts about hurting yourself? Have you ever tried to unalive yourself? Again, in the actual situation when interviewing the patient, you can use the actual words, but for YouTube purposes, I have to use the unaliving. If the patient talks about self-unaliving, it's imperative that you remain calm, you practice active listening, letting them talk, being very patient with them. It's also not recommended that you show signs of any kind of disapproval of their desires or to actually attempt to talk them out of it. Instead, if you do have a concern for the patient for imminent harm, then we refer them to the emergency department, for immediate attention and immediate psychiatric care. So the goal there is just to let them talk, let them be honest, and then treat emergently. Now, if there is not imminent harm, or if you believe that there is not imminent harm, it's acceptable to refer the patient to a mental health professional if they're able to see them within a few days. So that's definitely going to take some clinical reasoning on your part because you want to be cautious. And I personally would err on the side of the caution. If you thought at all that there was a chance that they wanted to self-unalive, I would be referring them for emergency care. So there are a few specific educational points here that I would like to emphasize and that should be addressed with our patients and, their caregivers. So one would be firearms. So research has shown that firearms are frequently present and accessible in the homes of children and adolescents that are at risk for self-unaliving. Important to note is that in more than 40% of self-unaliving deaths in adolescents between the age of 10 and 19 years old, firearms were used, and most of which were actually obtained within their very own home. So the American Academy of Pediatrics, they recommend for any at-risk children or adolescents that reside in a home with firearms that, one, the parents either remove the firearms from the house completely, or, and that's the best case scenario, but if not, restrict access by storing the firearms in a locked container, unloaded, and separate from the ammunition. And then the second point of education would be bullying. So multiple studies indicate that the risk of self-unaliving behavior is increased 3 to 6 times in the youth that are bullied compared to youth that are not involved in bullying. And so we must be talking to our kids about this as both healthcare professionals and as parents. We need to be asking questions, inquiring if they are being bullied or if they are treating people with kindness. if they are including others, if they see other students being bullied, what they do, if they themselves are being bullied, or if they see someone else being bullied. We need to be asking questions all the time as healthcare professionals and as parents. And if young people are on social media, especially as young as like elementary or middle school, they should be heavily monitored. And that's an important education point with our parents or our guardians. They need to be making sure that the content that they are viewing is appropriate and to ensure that cyberbullying is not occurring. Because, social media has added a whole new element to the possibilities with bullying. So research estimates that among adolescents, the lifetime prevalence of cyberbullying ranges from 10 to 40%. And it is believed that cyberbullying is actually more harmful than the traditional face-to-face bullying. And this is because cyberbullying can occur anytime, any place, including those areas that are supposed to be a safe space. So for example, within the person's home. Cyberbullying also allows for a potential large audience to view the online bullying, making it, increasingly more embarrassing for the adolescent. And the bullying can be viewed multiple times. It can be relived because, as we know, the internet is forever and a lot of this information is stored forever. And so because of these reasons, cyberbullying has been associated with an increased risk for self-unaliving behavior. And so it's very, very important that we talk about this with our youth and that parents are talking about this with their children. Schools are talking about this with their students. All parties should be involved in teaching our youth about bullying and specifically cyberbullying. Otherwise, I think that is going to be all for today's video. I hope you learned a little bit. Make sure if you liked this video and you found it helpful to like it. Also, subscribe to the channel so you don't miss any videos in the future. Otherwise, I wish you guys nothing but the best. Don't forget to learn something new every day, and I will talk to you soon. Bye, guys.